Hi, everyone, and welcome to our fourth episode of the Dallas Plastic Surgery Podcast. And with us today, I have a great and fun guest, my friend, co-surgeon, colleague, Dr. Bryan Armijo. And he's here visiting us. We're going to go over a few questions, and I hope you really enjoy this because I know for sure we're going to enjoy it. All right, so I will refer to you as Bryan. I don't want to be disrespectful here. I thought maybe we'd go over a few questions that some of the staff put together for us. This is going to be fun. Awesome. It'll be easy. It's all rapid fire. We have some rapid fire questions later. But the first question for us both is, which I'd love to hear this about you. I don't think we've discussed this. We've talked about so many things. What first drew you to plastic surgery, and how has your approach evolved over time? Tell me about that.
So I was originally drawn to orthopedics just because I like the outdoors and sports, and I had finished up my med school requirements early. I had about 4 weeks to dabble in another specialty, and decided to do plastic surgery. And first night in, I always thought, again, I'm a fourth year medical student. You think I would know this already, but I thought all plastic surgeons did was, purely cosmetics, and then I saw a lady come in and her arm was completely degloved, and the plastic surgeon came in and salvaged it. And I was able to shadow him, and he also had a thriving cosmetic aesthetic practice. And he explained how, both kind of benefit and enhanced, one with the other. And I said, I'm sold. That's it. I want to do plastic surgery.
That's a great point. I would say mine was similar. It's interesting how even as med students, we have no idea what the specialties do. I've had a few, right now, Dr. Armijo is actually my son is doing an internship, like a sub-internship with him. And it's really cool because he's seeing things that for you and I, they're so simple and basic. And my son is floored by the stuff that you're doing. He had no idea. And I would just think back into med school and even before then, where you have to kind of make some of these big decisions, just being educated on what the different specialties do. We are clueless as med students. Maybe even before residency, we're clueless, like what ortho does, what a kidney transplant, all those things. So similar thing, I was in Monterrey, Mexico, and I saw a craniofacial guy presenting, and I just thought, oh my gosh, I want to be the hero too. So it was similar. He saw real tragic situations, and then he was the hero. And there's something about men maybe that we want to be the hero. We want to salvage and help people.
Of course.
Mm-hmm.
Yeah. No.
Cool. Very similar.
100%.
All right. Question number 2. This one's on trends. What's a recent plastic surgery trend that you think might be overhyped?
That's a good one.
I'll tell you mine. That's going to give you a little bit of time to think. I think one of the recent trends that's crazy overhyped is filler. People started doing filler, and filler I think works very well. It's very predictable in the appropriate doses, but there does come a point where, and it seems to be very common, you're just overfilled, and there's pillow effect, and then some of the filler will move. The filler is promised to absorb, and it doesn't. It's actually still there. I see that when I'm in the faces. I see just goop of filler when I'm expecting tissues to adhere, and they can't because it's sliding because there's filler still in there. It makes the dissection more difficult. This is years after the filler is placed. So I believe filler has been overhyped. It can be a little bit dangerous, particularly in unskilled hands. That's where decisions are made, where maybe too much filler is placed. And I think that's going to start to change. We're seeing a lot of these biologic fillers being placed. Also, people are kind of turning towards surgery, again, properly done as well, before just getting more and more and more filler, hoping to put off the facelift. Sometimes when they're doing that, whether it's injecting fat or filler, the faces just get heavy and they're just putting off the surgery. And unfortunately, if you're going to have a rejuvenating natural procedure, you just have to pull the trigger and do it. So what do you think? What is overhyped?
I would 100% agree. I'll comment on the filler thing. And the benefit that we have and the people that we train to do our injectables, if we're not doing them ourselves, is we've seen the anatomy. We've seen the anatomy with our eyes. And there's so many places out right now that are, strip mall type facilities, and, they go to a weekend or maybe a week course. And like you said, there are danger zones, and in the wrong hands, you can cause a lot of damage. So definitely filler. You got to be careful. The other thing I would say is liposuction. And there are a lot of, strip multi-facilities again that just pump out these liposuction procedures and with different types of energy and radio frequency and ultrasound. And again, in the wrong hands, it can cause a lot of damage. And unfortunately, these poor patients show up on our doorstep and are asking for, some help. And a lot of times, some of the damage is irreversible, and they've, invested a ton of, hard-earned dollars, and, it causes lifelong.
It's tricky because a lot of times those places will do it under local.
Yes.
So it's a lot less expensive.
Yes.
But it's still overpromised, overhyped. They don't do excisional procedures, which is cutting out skin to tighten it. And a lot of those patients are disappointed, and they have nowhere to go because all they know is they don't want surgery. So yeah, I agree. That's a tricky one. All right, let's move on to the next question. Are there any emerging procedures or technologies you find particularly exciting or promising?
I would say with the evolution of the GLP-1, so these medications now that were originally introduced for, diabetes and sugar control, glycemic control, they've shown that they have tremendous strength and power in terms of weight loss, and, which is great. There's a lot of benefit to that, but it's changed a lot of how I personally approach body contouring and things like brachioplasty, thighplasty, abdominoplasty, mastopexy, breast lift. The skin quality is different, and these patients are protein deficient in many cases. And so you really, really have to make sure nutritional status is optimized before you go in. And how long do you stop the GLP before? Typically a week or two, depending on the anesthesiologist. But then afterwards, I think, is even more critical from a wound healing standpoint and the ultimate surgical result. So for me, that's a big,
and what do you, just for the listeners, I think it's important that they know, what do you know about nutrition? What's your background?
So I changed my major a couple of times and ultimately ended up, getting my degree, my Bachelor's of Science in Human Nutrition, and which I loved it. I loved every second of it. I think it's super beneficial because of wound healing and what we do.
Right.
To have a little bit of background knowledge, because in med school, we don't get a ton of nutritional education. So having that has been paramount, particularly now with these, like I said, the GLP-1 craze.
Yeah, it's such a popular topic. That was visionary of you. You were ahead of your time in deciding on that. Okay, I'll answer that. Emerging procedures for me, I don't know if you know, we've talked a little bit about this, but some of the facial procedures that I'm doing in younger patients, rather than separating all of the parts, particularly in the neck and the face, for the younger patient that's in her 40s, it's called delaminating it a little bit less. I think those procedures are cool because the recovery is faster. We don't quite have to do the same procedure that I would do, say, on a 60-year-old patient who just needs sort of a full procedure that's going to require, maybe a month recovery. Some of these easier procedures for the younger patients are very popular now. I think social media has really made that trend emerge. And it's a very cutting edge procedure. I'm super excited about it because I know how to do the bigger procedures. So doing the smaller procedures has been just real natural and almost easier to perform, but you do have to know what you're doing. It's still surgery. It's still a deep plane. It's still all the things.
So one second, I would piggyback on that, because so much of today's social media and a lot of plastic surgeons, for that matter, say they're doing deep planes, but they may not actually be doing a deep plane. And, for the audience, what's the difference between a deep plane and not a deep plane, and delaminating, and why is a deep plane so much better?
I mean, I think it's tricky because everybody out there wants to be an innovator, and they want, the Dr. Armijo procedure, the Dr. Meade procedure. And I think it comes down to allowing and crediting the surgeons before us with the procedures that they established, and just kind of taking it from there. So the deep plane procedure lifts up cheek fat and the tissue kind of beneath the cheek fat, but not quite to the muscles. So you truly are deeper within the tissues of the face. You also have to release a lot of the ligaments and things that hold our face in place. And then all of that has to be reset. So As you're separating those tissues and pulling those tissues, they then will stick. You're relying on the sticking of tissue to tissue rather than just kind of bunching, which maybe is the equivalent of the PDO thread. You know, those threads that all the dentists were doing and it didn't work. Everybody knows it doesn't work. Right. There's still people putting in threads out there, getting a little bit of a short-term benefit, but I think short-term benefit almost will equal long-term failure. I'm not a fan of the mini lifts. They're committing skin to be removed. They are very small procedures. They can look great for a few months, and now your facial anatomy is different. And you can't just go in and then later do the bigger procedure and expect there to be no effect. So the deep plane basically will lift up the neck muscle, the cheek fat, and the some of the eye muscle, and then kind of reset all of that. As you advance the deep plane into the composite lifts, again, that is now typically for the patient that's more in her 50s. These preservation style procedures are for patients in their 40s. They're great. You still get into the deep plane, but you don't get into the eye muscle. I may have misspoke a minute ago. You don't get into the eye muscle. You can leave the lower eyelids alone, and it's a much simpler operation, and patients recover. Within a couple of weeks, they're actually looking really good. Tough to tell that they've even had things done.
But they still have the long-lasting result.
Yeah, because you've lifted the jowl, the jawline, the neckline, all of that gets tightened up.
That's the big difference.
Mm-hmm. And you are releasing everything internally. Right. So let's shift now over to a question on social media that we got. How do you see social media shaping the ideal body image today? That's a good one. That's tough.
That is a tough one. Unrealistic expectations is kind of the one-word comment that sums all of that up, right? And with all of the filters that are out now and, you know, the simulators, which is tough for us, you know, because patients will come in and some of them they'll bring in their before and after pictures that they've done on their own, you know, app that they've downloaded with the simulator. And they'll be like, I want to look like this. And in some cases, you know, you can say, okay, I believe that based on your anatomy, what you're asking and what is aesthetically pleasing, I think we can deliver that. But in many cases, that's not it's not the solution. So I think it's just unrealistic expectations, and we kind of got to, you know, back things up and slow the roll and reset expectation.
Yeah, I find the same. There are simulators for facial surgery. So I think some of what triggered all of this was if you look at breast aug, and a patient comes in with small breasts, wants big breasts. And so she put it on the app. She put in a certain cc's of size for the implants. And then she looks at it and she says, wow, that looks amazing. And as you know, that sells. People want that. Now, if she gets her breast aug, and this is something that I did in my own practice, she gets her breast aug, loves her breast aug, but then compares her breast aug photo to the photo that the app did, it doesn't look the same.
Right.
I mean, it might be close. Breast aug is very close, but it doesn't look the same. Let alone give it a year, it's not gonna look the same. You know, give it a little bit of weight gain, a little bit of weight loss. Boy, that simulation is so far off. So realistic expectations. I think also another one is patient safety, where they're filtering their bodies to a point where, okay, 360 lipo, the tummy tuck, doing all these things. But I think just selecting a good surgeon that's going to keep them safe in their expectations and know, look, I'm going to exchange that extra stuff for a scar, or I'm going to exchange that extra stuff. There might be some lax tissue, you know, because one thing is the photograph and the other thing is just the reality of life. So I think it's important to have someone who's going to be very realistic with the patients, right? And hold back when it's time to hold back.
And to take it another step, even, you know, in our own specialty, sometimes you'll see photographs that are clearly, you know, edited or photoshopped. And that's tough for the patient too, because they don't, it's hard for them to decipher when that's happening as well. But yeah, like you said, the key point too is just find a good plastic surgeon, someone you get along with and agree with. And
well, I think that kind of leads into the next question is, how can a surgeon help educate patients about realistic outcomes while still supporting confidence and self-expression? So a patient comes in, she shows you a photo. Man, there's just no way. That's just not, it's not. But, and you see this, you know, where for me in the facial side, I see like a photo of, let's say, of her youth. And she's not saying, I want to look like this. Not, most of the patients don't want to look 30 years younger. They're just sort of saying, this is what I looked like. kind of what can you do, but they're not typically verbalizing like that. What do you see in kind of the body world?
I mean, the same thing. And it's all about just, again, taking a step back and educating the patient too, because a lot of them just don't know. The media glamorizes what we do as a profession, right? We're plastic surgeons. And yes, we can do amazing things, but, there are limits. And, hey, gravity and skin stretch always win. And, this is what I think we can achieve. And, if they accept it, then, that's a good relationship. If not, maybe you're not the right surgeon. Maybe I'm not the right surgeon for them, or, so it goes both ways.
Yep. All right. Let's talk about professional insights. This question says, can you share a case experience that reminded you why you love what you do? That's kind of a good one.
I mean, I would say for me is, when the patients come in at their, I typically see patients at 1 week post-op and then 6 weeks post-op. And there's a big difference between the 1 week post-op and the 6 week post-op patient. And the difference is a lot of swelling has gone down. And when those patients come in, you do the mommy makeover, very healthy, mom, 2, 3, 4 children who's fit. And, she has the classic breastosis, loss of volume in the breast, stretch marks in the lower belly, the diastasis. And, it's no matter how hard you work out, you're never going to resolve that. And when you can correct that for them and restore, their body and their self-image for them, and they come in tearful and thankful.
Yeah.
I mean, that's it. Like, it doesn't matter what happens the rest of the day, that feeling of empowering her again as, a woman, a mom, an entrepreneur, a wife, there's nothing like it. So for me, I mean, that's everything. And I mean, I'm sure it's the same with the face patients, right? I mean, you can't work out the face, right? And they feel young everywhere else. And, you can give that back to them.
Yeah. I agree. I mean, my case is a similar case where I think of a young mom that already baseline is striking, but there's certain things that just bother her. And a lot of times, at least historically, we were taught to kind of swing for the fences, radical changes, a tight neck, a lifted face, a stretched out look, an elderly woman, grandma coming. It's not necessarily like that. Some of these patients they look really good. They just are tired of seeing aging kind of encroaching on them. They just don't like it. And when you see that every day, sometimes you're just tired of it. And you're just thinking, let's say the patient I'm thinking of was an upper left and her nose. And the nose was a really subtle thing. And part of it was breathing. And so it's basically upper eyelids and the nose. And I could tell just by the photos that she was sending, she's completely different. To be honest, it's not that big of a difference, but she's no longer concerned about it. She's just sort of free from it. And now when she works out, she doesn't have to do this so that she can breathe. So that helped a bunch. It just helps in her daily life. I think those are, those are just ways where you can kind of be the hero and really help out. And that's kind of why we went into it. I'm not doing, cleft lips and which I don't know, that's not how my path landed. However, being able to help someone like that, I think just is really cool. And that's really something that, at the end of the day, you just feel good. You go home, you just feel good about your day.
Absolutely.
Yep.
Life-changing.
All right. I have a bowl. I have a bowl.
I have a bowl here of some fan-submitted questions for Dr. Meade and Dr. Armijo to answer.
All right.
Let's go.
Who goes first?
You first.
Rock, paper, scissors.
All right. That's a good idea. That's a good one. Ready?
Wait, is it rock, paper, scissors, then shoot?
Rock, paper. Okay.
Rock, paper, scissors. Oh wait. I did that on purpose. Okay. Rock, paper.
You saw what I'm going to put.
Bro. Okay. Rock, paper, scissors, shoot. Okay. Rock, paper, scissors, shoot. Boom. So wait, I decide. You go first.
Okay. Here we go.
I'm going to go ahead and pick mine.
First question. If you weren't a doctor, what would you be doing?
Do I answer that? Both of us answer that. Go.
Okay. I would be a forest ranger because I love the outdoors. And I actually told my mom and dad that. My mom's like, yeah, you'll never see your family and you won't make enough money. So pick another career.
All right. plastic surgeon naturally.
Yep.
I think I would be an artist. There's a place in Italy called Montepulciano, and I would just go and draw there with a pencil. And if it sold, I wouldn't care. And if it didn't sell, I wouldn't care either. All right.
Awesome.
Next question. Do you have a lucky scrub cap or surgery ritual? That's a good question. Me? I do not have a lucky scrub cap. I have multiple scrub caps. I do have one scrub cap that a scrub tech made for me that I did her breast dog, and I've used it so much and it's kind of gross, so I don't use it that much anymore. That's in the bias. What about you? Rituals?
No lucky scrub cap.
Okay.
And no ritual.
Yeah.
You know, I don't know.
You just think about what you're doing.
Yeah.
All right, pick one.
That was boring.
Pick one. Go for it.
All right, here we go.
What's the wildest beauty trend you've seen come and go?
I would say the weekend breast dog, which, you know, patients would come in on Friday afternoon, inject each breast with a liter of saline. It would take them from a B cup to a C cup, C and D cup.
Oh, yeah. Okay.
And then by Sunday,
It's gone.
you know, the body would absorb the fluid and it'd be gone. So it's a weekend breast dog. Come and go.
That's kind of nuts. All right. So I would say, as far as beauty, I don't know. I mean, I think the PDO threads are the silliest thing. They just don't work. Everybody knows they
It's
don't
like
work.
the weekend breast dog.
But
to
they're
the
still
face.
out there. And now their face is full of that stuff. I don't know. I don't like it. Okay.
What is your favorite genre of music to listen to in the OR?
Oh my gosh. I'm all over the place. Everybody knows this. That's not a good one for me. Maybe rock and roll, 70s, 80s, or 90s.
Rock and roll. I often defer to the OR staff.
Yep.
Because I'm like, if they're happy and content, I can focus on the surgery and do what I need to do. So,
Yeah. And it's all good. We're just really
yeah,
agreeable.
Exactly.
What's your post-surgery snack or meal?
Ooh, post-surgery snack. Jerky.
Oh, nice. Okay.
High protein. Easy.
Local yokel.
I can keep it in my backpack for
jalapeno
months
cheddar.
at a time.
I love
It
it.
goes bad.
All right. Little known fact, Dr. Armijo brought me some local yokel jalapeno cheddar beef jerky today.
Good stuff.
Post-surgery snack for me is embarrassing. It's a one of those ramen noodles from Marukan. I can't get enough of them, and I know they're not healthy, but
What's the weirdest or funniest thing a patient has ever said to you?
oh gosh, that's inappropriate. Okay, don't say that.
Yep, I got an inappropriate one too.
If you could swap jobs with any other kind of doctor for a day, who would it be and why? Well, that's a good one. My buddy Bryan Lima is a heart transplant surgeon. I would swap with him, but I'd have no idea how to do the surgery. So,
I mean, I don't know that I'd really swap. If you force me to pick something,
yeah, that's the
I would
question.
say cosmetic dermatology. You work Monday, Wednesday, Friday.
What?
You know,
Very surprising. All right, go.
just a lifestyle, right? All right. What do you like to do when you're not working?
Oh, me? I like riding my bike. I'm a big cycling enthusiast. Although I'm not fast at it, I really do love it though.
Same thing. I mean, exercise, be outside.
Yeah.
For me. I mean, because we're inside all the time, like just getting some vitamin D.
Who's most likely to stay on time with their surgery schedule? I feel like this was on purpose. It's probably Dr. Armijo.
I mean, I don't know.
Wouldn't you say?
We're pretty close.
Really? I'm not that good at
Pretty
that.
close in terms of time.
All right. I think that wraps it up. Okay, awesome. Well, thank you guys for visiting. I hope you guys enjoyed it. And that's a wrap.
Yeah, I appreciate the invite. Thank
yeah.
you so much.
Tons of
really enjoyed my
Tons of
time
fun.
and, you know, honored to be here.
You're the man.
He helped train me.
You're the man. No, we train each other. We're still training each other.
He did. I've learned, you know, more than you know.
No, we appreciate you, brother. All right. Thanks.
Thank you.